blunt needle on, and then
Yes.
you
You take your blunt needle, you draw up your Pepsid, you get your 2 mils, you take your blunt needle and you put it in here, and now you're diluted. Yes?
Yes.
Okay? That's the easiest way to do it.
Yeah.
Because if you're, say it was a medication that was 50 milligrams and you only needed to give 25. All right, so if you don't draw up your medicine first and you're putting it in your dilute, you might get too much. And then you just have to waste it, right?
Yeah.
So it's easier to draw up your medication and then add it to your dilute. Okay, so do it that way. That's gonna be a safer practice than trying to do it all with your dilute there, okay? The other way that you can do it is you can draw it up in a larger syringe and then pull back your saline in order to dilute.
So
The
amount of
important thing-
dilution isn't that big a deal.
3 to 5.
3 to 5 is
3 to
fine.
5.
Yeah.
And then the
It's
push
usually, I
time-
usually do 5 for everything. It's
Okay.
just a safer dilutant, unless there is a medication where it specifically says that it has to be diluted in 10. Like,
or something.
Back in the day when we gave Phenergan IV, it was 12.5 milligrams in 10 mils. So it had to be in a 10 mil syringe. And of course, when you have a 10 mil syringe, you still have enough pullback to be able to put a half a mil of fluid in there. You know, and that's it. So certain medications do require that whole 10, but for Pepsid purposes, we're gonna do 3 to 5.
Okay, and the push time is still per the drug mLs, not
Correct.
the total volume.
Correct. Not everybody had received that information during the lab itself. So if you're pushing the medication, right? And let me bring this up here because you don't want any air bubbles in there. And say, give me a time for Pepsid since we're talking about it.
2 minutes.
So it's going to be, no, your time.
6
So how many
seconds.
lines are you going to do?
20
We have
lines.
7 until 7 milliliters, right? Because it's 5 plus 2 ml.
How many seconds per line?
So 35 divided by 120 divided by 30. About 4 seconds
Okay.
per line.
4 seconds? I mean, I'm taking the word for it. I haven't done the math yet.
Okay.
Okay? So, you'll go look on your syringe, you'll scrub your hub, okay? You've already flushed it, you've already checked your patency, you've already did your first flush, you're getting the medicine, okay? For our purposes, we are not scrubbing the hub each time, but in real life, you would scrub the hub every time you attached a syringe to it, okay? But we're on 15-minute time restraint, so we're not going there. But if you want to verbalize, I'd clean the hub, I'd attach my next syringe. Your medication, 4 seconds. So you look at your graduates, you've got it attached, and you just go 1 line, 2, 3, 4, 2 lines, 2, 3, 4, 3 lines, 3, 4. So essentially, when you're pushing the medication, it's a start and stop. You're not doing a continuous flow. You don't necessarily have to watch your watch, because if you did your math correctly, it should take you that allotted time to be finished with it. Okay? So again, you'll just go 1 line, 2, 3, 4, 2 lines. Whoops, sorry. 2, 3, 4. Okay? You want to do the same thing with your flush at the same rate, because say you gave a patient some metoprolol, which is a blood pressure medicine, and you're giving it IV push. All right? You were all careful and everything else and doing it nice and slow. Now you came back with that saline and you just went pop. What's going to happen? You just gave them at least a mil in that little piggyback of blood pressure medicine, and then they're going to go, and you're going to go OS, right? What the heck did I do? That's why they want you to deliver the saline lock at the same rate as you administered your medication. Okay? Once you get about, if you're going to do a whole 10, you know, if you're anal like myself and you're going to give them the whole 10, do 5 at the same rate and then just slowly push the rest. You just don't want to give that patient a bolus of whatever medication you just gave with the flush. Questions? Are we good so far?
Yeah.
All right.
So on our LPE,
Yes.
are you gonna have, like, cause I see that there's multiple bottles and different, are you gonna put all those down, or is it gonna be pretty straightforward? You're
No.
gonna have exactly what
You
have
are going to
what
come
order?
in. Any visitors that are going to be coming to our lab on Tuesday morning, you need to make sure you sign in so you can get credit for being in our lab. Okay? Because some people have clinical different days. All right. So you're going to come in. The tables are going to be set up pretty much just like they are right now. Okay? You're going to have these beautiful colored cards. There's gonna be 4 of them face down on one side of the table. So I don't know, when you guys came in, I think there was medicines on one side and an arm on the other. It'll essentially be the same thing, because this is gonna be your entire workstation. The instructor will probably sit either on the end or next to you, all right? You will walk around, you will pick a medication card. You get to choose what 2 medicines that you're giving. However, you don't know what they are until you pull them, all right? So that's why you have to know those 4 meds, all right? So make sure you know the difference between the F's and the F's, okay? Because I don't want you to screw up and pull the wrong medicine when you pull your vial, all right? So you'll pull your medication, or your medication card, you'll look around, you can separate your medicines. I want this one, I want this one. That's gonna be your first check for your medication administration. And on the rubric, that's gonna be number 5. All right, so you already know your medicines. You have already made up your cards. You can bring your cards to lab that have all of the information if you need to dilute it, or, you know, don't push it with this, or, you know, if you have an IV bag, if you've made those cards out, you can bring those, okay? So after you pulled your card and you find your medication, you're gonna go ahead and, what was it, step number 6? You're gonna wash your hands. If your patient in real life had any kind of personal protective gear that you needed to wear for precautions, you would go ahead and put that on at that time. You're gonna identify your patient with 2 identifiers. Knock, knock, knock. Hi, my name is, I'm here to give you your medication. Can you tell me what your name and your date of birth are? You verbally ask them, you check their ID, right? Then you're gonna scan the patient's bracelet, just like you do in your clinical setting.